I'm Valencia. I'm from Singapore. I work as a respiratory consultant in my hospital back in Singapore, and I've been here for about 3 months as a clinical fellow with the ILD team here at the Royal Brompton. I've been here for about 3 months, and why I chose to come here for ILD, because this is an area of specialization that I'm interested in. I think it's considered one of the rarer conditions in terms of respiratory medicine, so there still remains to be a lot to learn about it. The number of cases that we see in our center is not that many as compared to a big referral center like the Brompton. So this is a really good experience for me to come to get in more exposure to complex cases and to really learn from all the experts here at the center. We do have a few areas of work that we do daily. One of it would be the inpatients. The inpatients are usually elective admissions, so they are brought in usually for more investigations, or they need further changes in their treatment. So we do ward rounds, we see how they are, we make plans for the day. We do clinics 3 times a week, 2 of which are just ILD clinics. And then we have one sarcoid clinic or some rare lung clinic that we also see patients in. And we do have a Wednesday afternoon MDT, multidisciplinary team meeting, where we discuss cases with pathologists, radiologists, as well as all the consultants. And that's a really good kind of learning session for the fellows, because you do hear their thought process, how they discuss the cases, how they go through the diagnostic, process of reaching a diagnosis, and how we actually deal with patients. And then, yeah, I think that kind of sums up the typical day. We do have some day reviews as well, where patients come in for infusions or urgent reviews that we have to see them. And it really makes us think, how we can help them, when we review them, what do we want to change to their treatment, what further tests we need. And a lot of these patients, they come from far away. So, we really force us to do what we can while they are here. For ILD, I think it's not so much procedure heavy. So we don't really do, there are opportunities to draw in bronchoscopy procedures with the consultant. On a weekly basis, we can participate in bronchoscopy, but that's not such a heavy part of ILD, not so much procedure based. A lot of it is outpatient, clinic focused, looking at scans, discussing cases. When I first came here, I was just, what we thought as, very rare conditions, doesn't seem so rare here, I guess, because we really see a huge number of them. When, back in where I work, we maybe see 1 or 2 a year, but we have a few just in one clinic session. So that was really eye-opening. And I think it also surprises me, because we do get referrals and calls from all over the country. So you really get calls from, 3 hours away, people calling you for advice. You really feel like, your opinion as a subspecialist is really valued, and how you can actually make changes to patient management even though they are so far away. And I think that's the value of being a specialist center with a lot of concentration of expert knowledge. So that's one of the special things about the specialist center. So back in where I work, I do see ILD patients, and I'm one of the few people who actually sees them. So coming to an expert center really helps me to really broaden my horizon in seeing more cases, and gives me more experience that I can really bring back to treat patients back in my country. It also opens me to, what are the new upcoming topics, and through discussion with the consultants, I really learned, how they think, how they approach cases, and that will, it gives me more confidence when I go back to actually pick cases on my own. So I think if you are interested in ILD, I think this is a really good place to get huge exposure to caseloads. I've had good experiences with all the consultants here. They're very open to discussing cases, sharing their knowledge, and I think, through speaking to them, they are all, well-known, experts in their field, and it's very enlightening when you discuss cases with them. You get some pearls of wisdom from them. I think it's also good that if you are interested in research, it'll be good if you have, you can kind of discuss it with them before you come, because it depends on how long your fellowship is. And it might be quite, if you're doing 6 months like myself, it may be a bit short to, come up with a big project. But, if you have something in mind, I think they're quite happy to discuss any projects just before you come, and then you can work on something as well when you're here.